Hello, everyone, and welcome to our Form webinar. Today's topic is medication as a tool for successful weight loss. My name is Dr. Lauren Lemieux. I'm a physician at Form, and I'm board certified in internal medicine, obesity medicine, and as a physician nutrition specialist. And I'm joined today by my colleague, Julia Axelbaum, who's a registered dietitian at Form and our director of nutrition, who's also certified in obesity and weight management. Just a few announcements before we get started. This webinar is being recorded, and we'll send you a link to the recording at the end of the session. And we do encourage you to participate by asking questions using the chat feature in Zoom. We'll save some time at the end to answer as many of these as we can, and your participation is completely anonymous. So with that, let's get started. Today, we're going to briefly review why weight loss can be so challenging and highlight the evidence-based effective weight loss tools. And we'll particularly spend attention on the FDA-approved medications for weight loss, as I know patients oftentimes have a lot of questions about these. So research has shown that our body weight is not under voluntary control entirely. In fact, there's numerous biologic, genetic, environmental factors that affect our weight balance. And it's important to try to identify and address these factors to achieve a healthy weight in a manner that's not just effective, but also sustainable. And researchers have also found that in the process of losing weight, our bodies actually respond with compensatory changes like a slowing of our metabolism, an increase in the hormones that make us hungrier, and a decrease in the hormones that make us feel full. And that makes it really easy to regain weight. And so that's why I like this picture here of this tug of war, where you can feel like you're doing everything right. You're trying to eat healthy and move more, but yet it feels like somebody's pushing you back in the direction that you came from. And I especially highlight this concept for two reasons. The first is to emphasize that it's our own biology, not something we have a lot of control over, that plays a significant role in why weight loss can be challenging. And second, since we'll be talking about medications for weight loss, these medications primarily work by reducing appetite and therefore help with addressing these changes in our hormones that increase appetite. And so it's not just addressing the process of losing weight, but also maintaining the weight that we've lost. And I'll discuss this in more detail in just a couple slides. So what really works for weight loss? Well, our research has shown that there's key foundational steps with nutrition, physical activity, and mindset shifts that are important for weight loss success. However, I do acknowledge that implementing these or maintaining them long-term can be challenging. And that's where working with the support of a professional can really help. For example, let's talk about nutrition. When we think about all of the different diets that are out there for weight loss, I mean, it can feel just confusing, overwhelming, or downright frustrating when trying to figure out, well, what's going to be best for me? What's going to help me lose weight and maintain it? So when Julia, our registered dietitian, is working with her patients, she's assessing their nutritional needs, their preferences, and ultimately working with patients to develop a personalized plan that's sustainable and enjoyable. And research has shown that this type of approach to nutrition is what really works for weight loss, what a person can stick with long term. Now, I do want to acknowledge that many of you listening today may have tried these traditional or foundational tools and possibly multiple times and still struggle even with the support of like a dietitian or working with a health coach. But in that case, if we're still struggling, we need to look at our toolbox and see what else is there that I can potentially use. And so that's where we might consider things like medication or surgery. And keep in mind, these are always thought of as going in conjunction with these lifestyle changes, nutrition, physical activity, and a healthy mindset. And that's because that's how research has shown them to be most effective. I find that this study really illustrates this point clearly, in that they took groups of individuals and gave them either medication to help them lose weight, intensive lifestyle counseling to lose weight, or a combination of the two, medication with brief lifestyle counseling or medication with intensive lifestyle counseling. And what you can see here is actually with just medication alone and no lifestyle counseling, people actually lost the least amount of weight. What we saw to be the combination for the most success was medication plus intensive lifestyle counseling. In fact, this group lost 2.5 times as much with that intervention. And that's why at Form, one of the key foundations for our program is that intensive lifestyle counseling. And then when medically appropriate, we may utilize medications. Now, I do want to highlight, this is an older study, and was done with a medication that's no longer on the market, but similar results have been presented with medications that we use currently. For example, liraglutide or Saxenda. In this study, they took patients and every patient received intensive behavioral therapy. The difference was one group received a placebo, so that's something that has no therapeutic effect. And you can see here in this gray line, they did lose weight with the intensive behavioral therapy, but the addition of liraglutide or Saxenda, that's the dark blue line, we see that they actually lost more weight overall and for longer term. So who is considered a candidate for a weight loss medication? This is essentially someone who's already tried, the basic nutrition, lifestyle changes, but been unable to lose or maintain the weight that they've lost. There's also a recommended cutoff for body mass index or BMI of 30 or higher, or 27 or higher with a weight-related medical condition. That can be things like diabetes, high cholesterol, high blood pressure, or sleep apnea. And if you're wondering, what is my body mass index? What's my BMI? There's a number of free online calculators where all that you need to enter is your height and weight, and it can give you that number. And then finally, candidates for weight loss medications plan to use the medication in combination with healthy nutrition and increased physical activity. So let's look at the medications for weight loss. What are they? This is a list of the current FDA-approved medications for weight loss. They include the GLP-1 receptor agonists. These are liraglutide or Saxenda, and semaglutide or Wegovy, naltrexone bupropion or Contrave, phentermine, which goes by Adipex-P or Lomera, phentermine topiramate or Qsymia, orlistat, which is Xenical by prescription and Ally over the counter, and finally Plenity. And you'll notice some asterisks here. So phentermine or medications containing phentermine are considered controlled substances. So they're not prescribed by our doctors at Form. And Plenity is technically classified as a medical device by the FDA, not a medication, but for all intents and purposes, you're taking a medication. And how do these medications work? Well, the majority of them work by decreasing appetite and cravings. I'll highlight here the GLP-1 receptor agonists. They have the added effect of slowing down digestion, which can help us feel more full. Imagine food sitting in the stomach a bit longer might make you feel more full. And then orlistat doesn't actually act on the brain or appetite centers to decrease cravings or appetite, but what it does is it blocks the absorption of fat from our diet. So essentially the calories that you would be getting from fat are not absorbed. And then finally, Plenity is taken with 2 glasses of water that basically turns into this fibrous gel in the stomach to physically occupy space. And that's so that you would physically eat less at a meal because the stomach is already partway full. Now, what medications don't do, I think is equally important to highlight. They do not significantly rev up metabolism, where now you're burning an extra 500 calories a day that you weren't burning otherwise. They definitely do not replace healthy nutrition and physical activity, something myself and Julia are very passionate about supporting our patients with, and we could literally spend this entire webinar, maybe a couple more, talking about why these things are so beneficial. And then they do not address our underlying life stressors, which for many of us can impact our weight. And then finally, they don't work for everyone, and it can take some time to find the right fit for each individual patient. I also want to highlight that there is the potential for weight regain after stopping. So when I talk to patients about starting a medication for weight loss, it's with the understanding that we're using this for long term. And this is highlighted very clearly in this study here, how when patients stop taking a medication, they're very likely to regain their weight. So what we're looking at is 2 groups of patients. One group is given a placebo, that's this gray line here. So again, that's something that has no therapeutic effect. And you can see they lose a little bit of weight with healthy nutrition and physical activity, but at about 120 weeks here, they're pretty much where they started. This dark blue line, which you can see quite impressive, we see a significant amount of weight loss over a year. At 1 year, they're down about 16, 17% of their body weight. These are patients who are taking Wegovy or semaglutide 2.4 milligrams. What they did at this study is at week 68, they then switched them over to taking a placebo. And you can see quite dramatically, the weight starts going back up. And in fact, at week 120, they've regained about 2/3 of the weight that they had lost. And it's not for lack of, sticking with healthy nutrition or physical activity. I mean, these patients were committed to staying healthy and maintaining their weight loss. But now that they no longer had the medication, you can see those normal physiologic factors that promote weight regain became very difficult to overcome. Now, I also want to highlight that there are FDA-approved medications that promote weight loss that we may use in patients, different from the ones on the list here. They include GLP-1 receptor agonists, as semaglutide in the form of Ozempic or Rybelsus. These two are FDA-approved for type 2 diabetes. There's metformin, naltrexone, tirzepatide or Mounjaro, topiramate or Topamax, and zonisamide. So why might we use a medication on the right as opposed to one on the left? So an example I'll use is, let's say I have a patient who's a great candidate for Wegovy, but unfortunately it's not covered by their insurance. In that case, let's say I can get Ozempic covered by their insurance. It's essentially the same active ingredient, semaglutide. The patient's a great candidate for it, and so it makes the most sense medically to give this one a try. But ultimately, it takes a really thoughtful process of understanding the patient. What's their medical background in making the decision of what medication ultimately to use. Now, patients often want to know, well, how much weight can I expect to lose with these medications? And while individual responses can vary, on average, from our clinical trials, we see for most medications, there's about 5 to 10% body weight loss. Now, you may be thinking, well, 5%, that's not very much. But what our clinical studies have shown is that even with 5% weight loss, we can see significant improvement in weight-related medical conditions like high blood sugar, high blood pressure. And what's really interesting is we're seeing newer medications come out where now we're seeing more than just the 5 to 10%. Now we're seeing up to 15% weight loss with Wegovy or semaglutide at 2.4 milligrams. And even more impressive, tirzepatide 15 milligrams or Mounjaro, we saw on average about 21% body weight loss. But I do want to highlight at this time, Mounjaro is FDA approved for type 2 diabetes, though it is on the fast track to get FDA approved for weight loss by the FDA. So how do we decide what medication to use for each patient? It really involves a careful consideration of your medical history. Are there certain contraindications to these medications? What other medications are you taking? And could there be drug interactions? Understanding the side effects of these weight loss medications and how likely it is you are to tolerate them, or could it worsen other medical issues that you have? And then we also consider, are there other medical conditions that you're working on that may benefit from these medications as well? So essentially killing two birds with one stone. An example I like to use is, let's say I have a patient who's trying to lose weight and they're also trying to quit smoking, or they also really struggle with depression. Well, it turns out bupropion is an antidepressant medication and a medication used for quitting smoking. So it may have numerous benefits for that patient with just one medication. Now, it can be very helpful to work with a doctor who specializes in weight management like myself and my colleagues at Forum, because we have experience prescribing and managing these medications, which many other providers don't have that same experience. But I always want to highlight that this is not just a matter of filling out a questionnaire or texting a provider to say what you want. And honestly, if that's what you're looking for, then Forum might not be the right place for you, because we are truly committed to helping our patients with the whole picture, addressing lifestyle, addressing how we can best support you implementing these changes. And then if we're also using medication, providing that additional support. So let's talk a little bit more about our approach at Forum. You are paired with an expert physician and a registered dietitian, and we utilize these important foundational tools of nutrition, physical activity, and mindset shifts, and if appropriate, medications. And our weight loss program is unique in that you're working one-on-one with these providers who get to know you. You develop a personalized nutrition and lifestyle plan that's tailored to your needs. It's not a one-size-fits-all approach. Your doctor, as I described earlier, will carefully consider your medical history, and utilize evidence-based treatments with the goal of successful and sustained weight loss, and also with the focus on improving your health. Now, medications for weight loss are not a quick fix, and they must be used in conjunction with these important foundational tools. And that's where we actually provide the resources to help you implement them and sustain them. With our program, everything is done virtually. So you join your visits with your doctor, or your dietitian on your phone, making that very convenient. You utilize our app for tracking your weights, taking pictures of your food, and chatting with your team. And in terms of support, I mean, it is a truly exceptional level in that you're meeting with a dietitian about every 2 weeks, a doctor every month. And if you have questions about our program, or want to know more details, please feel free to enter that in the chat, and we'll do our best to answer them with the time that we have remaining. But I'm going to stop there and leave you with this last point, which is at Forum, we've seen that our approach is effective and sustainable. On average, our patients lose 15% of their body weight by about 12 months. So I want to thank you all so much for your time and attention today. I'm going to have Julia jump back in so we can answer some questions that have come up in the meantime. But just want to highlight here our website, www.formhealth.co. In case you have any questions, or if you want to sign up, you can go there and answer our quick questionnaire to get started. Oh, Julia, I think you're on mute.
I was on mute. Sorry about that.
There you go. That's okay.
Thank you so much, Dr. Lemieux. We have some good questions that have come in, which I'll read out loud. And if anyone has other questions, please feel free to write them in the chat. So first question here is the mechanism of action for Saxenda and Wegovy the same? What factors do you consider to prescribe one over the other?
So broadly speaking, Saxenda and Wegovy are in the same class of medications, GLP-1 receptor agonists, but they're technically two different forms of GLP-1 agonists. And the studies have found that when looking at Wegovy versus Saxenda, patients actually lose more weight on average using Wegovy. So that might be one factor that I keep in mind for patients as to why I might prescribe that as my first choice. The study that I'm referring to, we saw about 15% weight loss on average with Wegovy, compared to only about 6% with Saxenda. There's also other factors to consider in that Wegovy is a weekly medication, whereas Saxenda, it's a daily medication.
Great. My insurance doesn't cover medication that's intended for type 2 diabetes unless it's prescribed for that.
Mm-hmm. Yeah, so that's not an uncommon thing that we encounter. And in fact, insurance companies have been a lot more, strict in that regard in the past. Medications like Ozempic, which are FDA approved for type 2 diabetes, some patients could get covered off-label for weight loss. And now, in some cases, that's been more challenging. That being said, I did present a list of a number of different medications. Not all of them are indicated for type 2 diabetes, that you and your doctor can discuss and decide, which of those might be an appropriate choice, and keeping in mind, what is or is not covered by insurance.
Okay, this next question I think I can take. It says, how do you decide what sort of diet plan to put your patients on? So I'm a dietitian here at Form, so I'm happy to spend a few minutes explaining this one. I guess the first thing to start off with is that all of our patients get matched with a personalized care team. So all of our patients work with an obesity medicine doctor, a registered dietitian specialized in weight management, and a patient care coordinator. And our goal is really to focus on getting to know you, really understanding your own personal medical history and your background and your lifestyle and your food preferences and what you've tried in the past and what's worked and what hasn't worked, and really try to target the root of what's getting in the way for you so that together we can create a treatment plan. So there is no one diet that we prescribe that every patient at Forum goes through. It's really completely customized to you because our whole goal is to address the factors that are really getting in the way for you. So this can look so different for different people, but I'll give you some examples. I might see some patients who are actually eating very healthy diets and high quality diets, and maybe their struggle isn't eating large portions at meals, but maybe their struggle is more around emotional eating, for example. And this one's common. A lot of us deal with this. And so for patients like this, just handing them a diet plan, even if it's the best diet plan in the world, is not going to really get to the root of what's getting in their way. So for patients who are struggling with emotional eating, our dietitians are specialized in cognitive behavioral therapy techniques to help our patients break bad habits, work through self-sabotage, emotional eating episodes, strategize for high-risk situations. Another situation might be maybe there's a person who we meet with who is really just having a hard time finding a plan that's sustainable. Maybe they've tried lots of different restrictive diet plans in the past, and they're left feeling hungry and irritable and low energy, or maybe they lost weight in the past and they gained it back once they, stopped following the diet. And so for patients who are struggling in this way, we teach a really simple, straightforward plating approach, the form plating method, where we teach you how to build meals using visualization techniques, including all of the food groups. There are no foods that are, off limits that you can never have. And the nice thing about this is we do it without counting calories or without complicated math or weighing or measuring. We teach visualization techniques where you look down at your plate and kind of eyeball what a weight loss meal will look like. And the feedback that we get from our patients on this is that it's a system that they feel like they can really stick with forever. It doesn't feel like a fad or a short-term fix. We're teaching you strategies that you'll be using for the rest of your life. This is really targeting the root of, what these patients tell us that they're struggling with. So it's completely personalized to you. We really spend the time working to understand how we can best help you. And we also really believe in implementing small changes that add up over time so that we can really kind of take strategy over strategy, habit over habit, over a long period of time and build a plan that you can see yourself sticking to for the rest of your life.
Yeah, and I want to just add, to your point, the goal is something that you can stick with. And so even the term diet to me implies something that you're on a diet or you're off a diet. But this is not what it is. It's all about creating a nutrition plan, lifestyle, a pattern that works for you and doesn't feel like a diet. And that's what I hear a lot from patients, and you probably do too, Julia. They feel like, I finally feel like I'm not on a diet. And it's like, great, that's what we're aiming for, because we want this to feel natural. We want this to feel comfortable, and we don't want you to feel deprived. But obviously we have to create some balance. And we also have all of these really wonderful like cooking classes. So if you're just kind of learning how to get these healthy meals, set up for yourself, then you can actually learn how to do it and do it in a quick, efficient way. So it's not taking all weekend to be cooking for yourself when you have other things to do too.
Yes, exactly. I always say the line to patients: any temporary changes are going to lead to temporary results. So our goal is finding changes and habits that you can really see yourself sticking to forever so that you can keep the weight off forever.
Yeah.
And actually, just to add, Dr. Lemieux was talking about the cooking classes that we have. So there was actually another question here where someone was asking if all of the meetings are one-on-one or if we have any group interactions or if you ever interact with other members of the program. So each month, actually, we offer a wide variety of group classes in addition to the one-on-one sessions that each patient has with their dietitian and physician. So we have cooking classes, which are fantastic. We have support groups, which is a really nice opportunity to connect with other people going through a similar journey to you, get ideas, talk through challenges, and really sort of build a community like that. We also have a group class, sort of more of a weight loss 101 kind of education class, that the topic changes every month, and over a full year, patients are able to obtain this really full, high quality nutrition, weight loss education. So those are some, and then we also have different groups that pop up at different times of the year. So for example, around the holidays, we have a holiday eating group, things like that. So there are lots of opportunities to connect with other members of FORM outside of the one-on-one visits. And one other thing that I'm just realizing I didn't mention is we also have a private Facebook group where, and our patients love this, where you can post and ask questions, and it's just a great way to, again, find a community of similar, people going through the same kind of journey that you are at that time. All right, here we go. Let's see. Okay, this person said that they already joined and they're excited to get started. Great. We can't wait to meet you.
And I think I saw maybe some questions specific about, medications that someone might be taking and how would that work with some of these weight loss medications. And just to emphasize, like, that is what we are experiencing. That's what our expertise is in, working with patients, knowing your medical background and deciding, what's most medically appropriate and safe and what makes sense with the other medical conditions that you have. So it's hard for me to give a specific answer for each person, here without knowing your medical history and talking with you one-on-one. But I definitely encourage you to, join up and start and meet our providers and hear what we have to say, because I think you'll be very, very happy with the sort of attention and expertise that we have in helping you with your weight loss journey, where you may not be getting that from the other providers that you're working with currently. And of course, unfortunately, there are medications that some patients have been taking oftentimes for many years that contribute to weight gain. Doesn't necessarily mean we're going to, stop it right away. But for example, like insulin, for example, we see that with weight loss, insulin needs can start to go down and insulin can cause weight gain. And so there's nothing I love more than helping patients get off some of these medications that they've been on forever. Insulin is one of high blood pressure medications as well. With weight loss, we can start to peel those away, assuming that blood pressure is well controlled. And that's really exciting because it finally feels like my weight is not holding me back. It's not affecting my health in the way that it was before.
And I see one last question here, which is, how long do patients typically stick with the program?
Yeah, so we actually have a great cohort of patients who have been with us even since the start of our program, which at this point has been 3 years. I personally don't have the statistics you, Julia, on who's here after a year. I don't want to misquote.
Yeah, I know
have a
that
number in my head, but
right around 50% of our patients are
okay,
still with us after 2 years, actually.
Mm-hmm.
I would say, I don't have, the exact statistics offhand, but I feel that one of the things that makes us so different and that keeps patients with us longer term than other programs or other places that I've worked is the relationship that the patients really develop with their care team. The dietitian and your medical provider, they really care, they really get to know you, and it's such a higher level of support than just a typical, doctor visit. We are seeing you several times a month. The dietitian visits are typically every 2 weeks plus a medical visit once a month. And in addition to that, you have access to text us through the app in between. So I have patients who I'm chatting with, I'm texting with, most days of the week, kind of checking in, talking through what's going well, talking through challenges, strategizing. Maybe they're sending me a menu because they're going out to dinner tomorrow night and trying to figure out what to order. And so that, I feel like that level of support is what people find so valuable in the program. Mm-hmm. And I mean, from experience find patients sticking with us for a while, but the nice thing is there's no requirement to do so. And I think that's kind of something that we've all had experiences with in the past with programs or gyms where you sort of get locked in and you have to pay up upfront in the beginning. And it's not like that. Everyone has their own goal, and some people might reach that goal sooner. Some people might want to stick with it longer, and it's completely up to you.
Yeah, and a couple of things I just want to add to that. One is that when we think about weight management, it's essentially a chronic thing that we're managing. You probably struggle with your weight for a really long time. Just because you lose your weight doesn't mean this journey is over. Now we enter maintenance phase. And sure, when you're in maintenance, you may not need the sort of like every month check-in, and that's fine. We have patients who, space out their appointments, and we can do it on a slightly different cadence than that more intense pattern that we have at the very beginning. But the other thing I want to highlight is we don't just kick you out once you've lost weight. Like, you're with us, you're our patient. We want to be there to support you. And even if it's just, in my case, let's say a patient's doing great, maybe they see me every 3 months to check in and make sure things are going okay. And from a medical standpoint, there's things that I may be monitoring, like let's see how your liver and kidney function are doing. Let's see how your cholesterol is doing, your A1C. So we do keep up these appointments, for patients who are with us in the long term, even at that maintenance phase. But we're very flexible in terms of the level of support that you need at the time you're going through this process. And some people need more at the beginning, most people do. And then as they kind of get into that flow or have hit maintenance, then we can space that out if that works best. If not, we still keep up the every month, every 2 weeks type schedule. And that level of support, I mean, it's very hard to find something like that anywhere else.
Okay, I think we answered all the questions.
All right, great. Well, thank you all so much for joining us today. It's just been such a pleasure getting to chat about something that both Julia and I love so much.